as people relax some of these social distancing and other strategies, we're going to see potentially other viruses like RSV in our community again. And one of the things we were talking about before this was even just for ourselves, should we be wearing a mask or not, even in this situation? And we'll talk some more about masking because we know it's an effective tool. It's a tool, it's not 100%. But all of us are starting to kind of be more, conscious of wearing masks again. And so kind of what we had discussed is we knew that we had both been vaccinated. We kind of went through our risk criteria. We'd both been vaccinated. We had not had contact with anybody that had COVID that we knew of. No symptoms ourselves, and we were going to try and maintain our social distancing. So we kind of went through that checklist that we've been asking everybody to use. And so we did decide that if it's okay from here on out, we would take off our masks and utilize kind of that checklist, if that still sounds okay to you.
I'm comfortable with that.
Okay, great. Yeah, and we wanted to, I'll take off my mask, but use that as an example because a lot of questions we get right now are, when should I wear a mask? When should I not wear a mask? And there's really kind of that whole kind of set of criteria that we tell people, like it's one tool, but all of those other things are important. And the reality is, I think that when you're out in a public setting, there's not the time to take to do that assessment. Am I around people that are vaccinated? Am I around people that have been exposed to someone or people that might be sick themselves? So that is why I think we're seeing a lot of the mask requirements coming back, including in our schools, because it's a tricky thing to do in public setting versus in a one-on-one situation like this. Is that kind of what you've been teaching people too when you talking about masks?
Absolutely. There are certain interventions that we encourage. We're still kind of going back to the same thing that we've been talking about for the past year and a half, which is mask up, stay distance, wash your hands, and those are really the tools that we have. We now, of course, have a very effective tool as well, which is vaccination, and so we're really strongly encouraging that as well. But unfortunately, none of these interventions alone are 100%. And so we're trying to encourage as many people to practice safe behaviors and also monitor yourself for symptoms. And don't go into work if you have a cough. Especially with this new Delta variant that's coming out, we see that the symptoms are a little bit more of the common cold symptoms, so kind of more runny nose and cough and those types of symptoms, sore throat, than the original virus. And so it's hard to distinguish between colds, allergies, or COVID. So really so incredibly important to keep masking up, wash your hands, and keep distance. And if you can, get vaccinated.